Hello, I'm Milton Yogi, a cataract surgeon in São Paulo, Brazil, and I'm very happy to have our dear colleague, our friend, Dr. Neto Rosatelli, who I invited to bring in some ideas, some insights about being a high performance surgeon. Thank you for coming here, Dr. Neto.
Thank you, Milton. It's so nice to be here. It's a pleasure, it's an honor, and I've been following you for many years, and I admire all your work, your way of thinking, and you're pushing the edge of ophthalmology education. So I'm very proud to be here, and thank you for the opportunity.
Yeah, thank you. I've known Neto for so many years now. I invited him to discover some things about his mindset, his way of thinking in terms of being a surgeon. So we have our colleagues here in this room as well, our fellows, and you can be very welcome to bring in some questions as well. And Neto, I know that you bring out some bullet points in order to talk about some specific points that you consider important as being a surgeon. And I think it's quite relevant because we watch so many of your surgeries in your YouTube channel, but I always wonder in terms of what drives you, what are the key points in terms of your way to perfection. I think we all can learn from you.
Oh yes, I took the opportunity to bring these like bullet points of attention. This would be like conversation starters or just reminders of the many aspects that I think are important in my practice and that have all these years driven me to be, the surgeon that I am and that I wanted to be. And I think this is very important for, of course, any surgeon, but it's interesting because we are talking about it now. Most people think that technical skills are the most important thing that a surgeon must acquire. And of course, they are important, they are essential, of course, but most importantly are character skills. Character skills are what allows the surgeon to acquire, to pursue the technical skills. If the surgeon does not have this, and I'm going to enumerate this: resiliency, curiosity, initiative, persistence, diligence, restlessness. This is one of the most important ones. Ethics, leadership, humbleness, but also vanity, pride, and arrogance. These three are not like, say, that wouldn't be so very nice character skills to have, but they are the ones that allows you to be proud of what you are, to pursue, let's say, to be content in acquiring some experience, some skill, to be able to do a very difficult thing. So they are important also, but this is, it might seem maybe paradoxical to say that character skills are so important for a surgeon. In fact, this is important for any area or field of human activity. Character skills are the most important one. Technical skills you'll be acquiring depending on which character skills you will have. Personality is what you are born with. Character skills you choose, the ones that you will enhance, you acquire. So this is most important. The surgeon must have this in mind.
Yes, and the first one is resilience that you point out. In the life of the surgeon, there are so many instances that you fall in your motivation. Do you have hard times, Neto?
Yes, of course. And one of the things that helps us in terms of being resilient in hard times is to be aware that you will be a better person after that. Hard times, hardship is what forge us to be better persons. Because let's say we don't get better living through, let's say, good times. Good times you enjoy,
Yeah.
but you don't get better. But when you go through difficult times, hardships and everything like that, you learn to be a better person. You learn to survive. You acquire so much going through hard times. And then when you are in this situation, you must think, oh, at least I'll be a better person after that. That's something that helps you to be resilient. You know that you must, let's say, go through and have an iron will to go through these difficult times. Be those, let's say, through a large amount of time, to a large period, or just doing a surgery when you face a complication. It's the same thing. So this, of course, this is a most essential one for a surgeon, because it's very difficult to learn surgery. Yeah. So you must be resilient, not to give up. If you're not resilient, you will give up learning, because it's so difficult. You fall so many times before you are able to walk, let's say, in a good way. So that's it's most important.
I've seen so many colleagues even giving up being a surgeon, and it's healthy to have friends, colleagues that help you in these times.
Yes, I think you should take the opportunity to, let's say, learn, of course, with your colleagues, learn from more experienced surgeons, and learn from more experienced surgeons' mistakes. This is very important. But I think many times, or more often, the surgeon has some difficulty going through, let's say, a bad time, because he or she doesn't feel prepared. It's then this brings some insecurity, and this beginner process that, let's say, makes the surgeon goes downhill, let's say. So one of the most important things a surgeon must be is prepared. Be prepared, expect complications. And let's say, not only, of course, in your mind, but in the practical ways. You must, if you're going to do some surgery in a complicated case, or even an uncomplicated one, be prepared with material, with anything, and technique to resolve this complication if it happens. This is, I think, it's a very effective way of you to face complications. You know that you're prepared, you have everything, and then go step by step. We are almost always, when we face a complication, talking about that, we want the surgery to be over as soon as possible. And this is exactly the opposite of what you should do. You must slow down, you must do step by step, and when you face the difficult thing, let's say this challenging surgery complication, step by step, it makes it so much easier. And then, let's say, if you're going to have some vitreous coming out, you say, let's stabilize the anterior chamber, put some OVD, take your time. And then you must see what instrument will I need, what I am supposed to do next. And in this way, you gradually conquer this complication. You must not panic and, oh no, I want to, of course, that's our natural instinct, to be over with that. And That's not what you should do. So this is one of the things. Slow down and think one step by step. This is something that will calm you down. You'll be able to think rationally, and in most cases you will end up much better than you would expect. And this brings you confidence for the next one that will come. Everyone that the surgery will have complications. So this, I think, this is the right way to face a complication, to face difficult times. Think that I will, let's say, get over this. Let's just have the resolve to face that, and do it in a slow way. Usually is the best thing to do, especially in surgery.
In terms of the mindset, you have to be always alert and prepared. There's a quote, I remember one of the movies of the Bourne Identity, and the quote said something like, plan for the worst, hope for the best. I think one of the tactics is to prepare the best you can in terms of the resources, knowing your equipment, knowing your instruments, and knowing the steps, to be prepared for these instances.
Well, of course, the most important things, first, the surgeon must know. Let's say we usually have some kind of protocols in many types of surgical complications in the eye. So if you have some, let's say, a posterior capsule rupture, or when you have vitreous prolapse and so on. So the surgeon must know, be aware, and have this, let's say, deeply imprinted in his knowledge what to do, the right way to perform that. This is a big first step, because if the surgeon, let's say, is not prepared with knowledge for that, he or she won't be able to address this complication properly. The second thing, of course, is, let's just say, the resources. You must have the instrumentation, you must have everything that you should need, be it a suture or some special OVD, or the vitrector probe, and anything like that. You must have this ready at your operating room, because when you need it, it's there. You won't have to, let's say, improvise. There's no such room for that. So the surgeon, when he or she is prepared like that, it's when you have the complication, much of the stress that you could have won't happen, because you have everything. Then it only depends on you. Of course, many times the surgeon does not have the experience, never did that, but he knows how to do it. And nowadays we have a wonderful thing that is the internet, where you can learn by watching videos of complicated surgeries. And we are observational animals. We learn so much from observing, and it amazes us that just from observing something on how to do, you are able to do it. You know how to do it. And so this is something that, of course, today we have the opportunity to do that. And with, maybe we have surgical simulators that are getting better and better and more immersive and more, let's say, a real experience of the surgery. And many of them already have complication, like in a flight simulator, for example. You have complication scenarios for you to train. So I think this is something that will help the surgeon immensely. And if you have some, of course, difficult surgery or expected, let's say, a complicated surgery, some surgery that you will expect some complications, having someone more experienced with you, of course, helps. But you must do the complication yourself.
Yeah.
Your more experienced colleague can act like as a tutor, as some mentoring, and let's say advising you how to proceed. This, of course, gives you confidence, but there will be a time when you are alone. So you must be prepared to be alone and face that. So being prepared is most essential. As I said, not only in resources, but all, of course, in your mind. To be tranquil, to face the complication properly.
What do you mean by diligence?
Diligence would mean that you must be so, let's say, a perfectionist. You must perform the surgery with diligence. You must perform the step like it is supposed to be done, and very, let's say, I don't think almost every surgeon is a perfectionist. This is something that most surgeons, let's say, a characteristic that most surgeons have. We are perfectionists. So when I mean that this is something important, that, be diligent when you do so. Be perfectionist. Do it in the proper way. Let's say following not following the rules, but doing in the best way possible. So do it well. I think this would resume that. This is what I mean by diligence. Yeah. Humbleness. What I mean by humbleness is you must not think that you know everything. And this is, well, let's say, regardless of your experience or skill level, you must think, you must feel, you must believe that you have something more to learn. If not, you will not be able to learn from other colleagues in a good way. So humbleness is the most important thing, of course, for a student to have, to be able to look to, let's say, to absorb knowledge and to think that I don't know everything. That's what I mean by humbleness. In this aspect of facing something that someone else is teaching, someone else is explaining, someone else is showing, and you say, maybe, let's say, many times our experience is experience in terms that the way you do things is much different from the way another surgeon is doing. And when he or she shows that, you say, look, this doesn't feel right for me. But when I mean by humbleness is I should believe him or her, because if he or she is doing this and is working for it, might work for me. And I have this first-hand experience many times. I've seen so many techniques that at first it looked for me like this nonsense. Mm-hmm. And then over time, as I was trying to do it many times in many situations, years apart from the first time that I saw, and then many years later, when I was more experienced, I said, let me try that again. Mm. And then I said, this is very good. And I wasn't able to see that at that time, and I didn't believe it at that time. So this is something that I see when I show something, and I sometimes really show some crazy things, and people are, let's say, I don't think this works. But if it works from some surgeon, it might work for you. It might not be, let's say, more practical or fit your practice, but you must give, let's say, some have confidence in what other people say, so that we're able to learn. Because we see so many surgeons that say, I know everything because I have very experience, I'm old already, and so I have nothing more to learn from anyone. And this is very wrong, because we say, and there's another aspect for that, not specifically talking about humbleness. I completely disagree to the saying that old dogs don't learn new tricks. This is completely the opposite. An old dog can learn a new trick like that because of his experience. So we must see, let's say, we must believe that we can learn new things. I think that would resume what I mean from humbleness.
Yeah.
Yeah.
And what about this one?
Yes, genius cannot be taught, but skills can.
Okay.
We like to, let's say, we like to see, to, let's say, to look at some persons and say, oh, this guy is a genius. And many of the ones that we admire are geniuses. But all of them rely on technical skills to be like that. We could say Michelangelo was a genius sculptor, but he depended completely on his sculptor skills that he acquired during his life, and so many others we could say. So, we think that when someone we see as a genius, I'll explain why I'm talking about genius, because when someone when we see someone doing things in a, let's say, outstanding way, we say this guy is a genius. Mostly not. Most these are the result of intensive training and let's say so much persistence in acquiring that. Like, I'm comparing, but like we will say, you when you see some artist in a circus, you say that's impossible to do. You see a guy juggling 7 balls, you say that's impossible. No, it's not. He did it. It's a result of years of training and persistence and so. So we like to have this like a romantic way of thinking that, oh, this guy has a talent for surgery. Maybe, but he trained a lot. I'm going to, let's say, talk about this in a later slide. So what I mean is, sometimes we look at someone and say, I'll never be like that. You can, because he did it. He is. And you're not much difference in anything else. So this is something that sometimes we say to be comfortable, of not trying to be like someone. And you should, because you can. So I think this is, let's say, something that, I don't know why, but we romanticize this view. Oh, this guy was born with a talent for that. No, he trained for that. So, of course, there are some people that are geniuses in some, let's say, field. Yeah. But mostly what we see is the result of very intense practicing and training and anything else. Yes, we have a slide later that will talk about that.
Okay, so we have this next slide, Neto.
Oh yes, talking about improving your surgical technique, enhancing your surgery. I think this is the tripod that in which this all relies on. Deliberate practice, what would that be? Deliberate practice is every single time you're performing a surgery, you would do each and every step the most perfectly you can do. This is what I mean about deliberate. This is not something that, let's say, I invented, or this is, let's say, a general knowledge concept. in everything that you, in many fields, but in surgery it applies perfectly. So do the surgical step perfectly every single time, and pay attention in that. Do not perform it like in a bureaucratic way or without thinking. As you brought an important point a little earlier, and I didn't wanted to interrupt. It's about humbleness. Be humble to respect your surgery. Expect complications, because despite your surgical skill, you will have complications. So respect the eye. Do it diligently every time, because if not, that's the way we have complications. It's when we relax and do not pay attention too much, and that's when the unexpected occurs. So deliberate practice. Work in a consistent environment. You must control the most possible everything you're doing. Let's say, beginning in your position, in your chair, your microscope, everything in the room, having everything. So work in a consistent environment so that you may have consistent results. And perform immediate result evaluation, especially when you are doing some new technique. See if this is bringing the result you were expecting, and see if these results are good. You must do that in order to improve your surgery. Let's say, detect, know what you're doing, if you're doing is being good or not. This is important for you to improve. So always pay attention to these points to improve your surgery every single time. As experience comes, you have, let's say, I think, a big enemy of improvement, which is being comfortable the way you're doing things. Because when you're comfortable, you relax, and then complications happen. So you must always, like as I said, respect the surgery. Respect. This is something that sailors say about the sea, the ocean. Respect the ocean, because it can be very bad for you. So, and pilots say about that, about the weather. Respect the weather. That's how pilots live longer, because you may have, let's say, old pilots and bold ones. You don't have bold old pilots. No. So that's one way to, let's say, illustrate this situation. Respect the surgery. Do it well. Even when your level of skill allows you to perform it like in an almost unconscious way, because this is dangerous for your surgery. So if you pay attention to that every single time, that's how you improve your surgery. And it's amazing on how you begin performing. Let's talk about the capsular axis, which might be the most important, one of the most important steps in surgery. Initially you have some kind of difficulty, and as you progress doing it every single time perfectly, you will notice that there are more things that you can improve in this particular surgical step as you acquire some, let's say, some level of excellence, like doing not allowing the capsular axis to run out, and then doing it perfectly round, and then getting it centered every single time, and then getting it centered in very difficult cases like shallow anterior chambers, or when the patient is not cooperating, or in tumescent cataracts, etc. So you can see your progression because you did deliberate practice every single time. That's the way to improve. And then you gain confidence and you are able to go, let's say, in another level of perfection that you are not aware of. That's how we will improve. So, and of course, paying attention to the other aspects.
Distração, meditação, alguma coisa para você entrar em cirurgia ou não? É algo...
She asked if before surgeries or before my surgery, I start my surgical day, if I do some kind of meditation or let's say some preparation. We work as a team, and I have a big team on my room, usually 6 to 8 people assisting me in every aspect of the surgery, positioning the patient, doing instrumentation at the phaco machine and the table, and etc. And before we begin our surgical day, we make a prayer, and this prayer is for us to, let's say, we enter in the state of the surgery. That's the meaning of that. And then we, let's say, a wish for a good day, and we wish that the patients go well, and it's usually something like that. And then we pray, let's say, a Catholic prayer, and we start the day. And after that, that's when we start the day. This is something that, let's say, brings all of let's say, my team's minds to the surgery. And before if you go there, this what I'm going to tell, it might be unnoticed, but when I'm starting a surgery, when with the assistant that is doing the instrumentation, we finish draping, put the eyelid speculum, and when he or she will give me the keratom, that for me, I do like that. This is something that was, it's an interesting story. In Japan, in the 50s, 40s and 50s, there were so many accidents in the train, let's say in the train stations, because of difficulty of communicating the, let's say, between the railroad workers in the train stations, because they are far apart, and sometimes there will be some accidents because of lack of difficulty of communication. And then they developed something that that's the way I knew the story. It's called the yogi, okay?
No.
And it's a kind of sign that they communicate with them. I don't know how it was in the railroad, between the railroad workers. I know this was brought to the Toyota factories, because they began when they expanded the car production in the 70s. They were having so many accidents because of this difficulty of expanding their activity. They brought the yogi practice in their factories, and I'll explain why. So I don't know how they did to, let's say, call attention, and they let's say they would do, in the railroad workers would do something that would require attention, like changing some railroad lane and signaling and everything else. They did that so that they were in sync and attentive. And in the Toyota factory, it was very common to have, let's say, the factories are big, and you have like streets inside the factory, like between the production stations, you have lanes, and they had some lanes that some let's say vehicles. I'm forgetting the name of the things that gets the pallet and
The forklift.
yes, the forklifts. It was very common to have
Crashes?
yes, between let's say a forklift get a worker because he or she would be crossing the street and the lane where the forklift was going. So they instituted something that before crossing any lane inside the factory, the worker should stop and clap. Stop and clap. So that would bring him attention to. And they said that you could identify Toyota workers in the streets because before crossing any street in the city, you would see people like that clapping before crossing the street. And so I brought that because the very first step that I would do would be using a diamond or a sapphire knife with the needle to using the patient's eye. And let's say this is the most dangerous time of the surgery to have some accident because you have very sharp instruments, so we could hurt each other. So I brought this to, I don't make any sound usually, sometimes I do, but when I do that, the instrument, the instrumentation assistant gets his attention, I look at, and then we start surgery. And then we are in the same, let's say, I don't know how, in the same vibe to do the surgery because we started his or her attention is exclusive. This is something that works like a charm. And we are like that. Sometimes I'm talking, so then I do that and that's the surgery. So I do this before every single surgery. And it became so much, let's say, something that I do every time. And it helps me to instantly focus on the surgery. I stop every, let's say, some other things that I'm thinking, I put apart and focus on the surgery. So this is what I do before every surgery. The yogi, yoji, I don't know how this would be the pronunciation in Japanese, but it's the yogi, no, I don't know, sign or like that. Yeah, and it's impressive how strongly this works.
Yeah.
It's amazing because when I do that, instantly my mind goes in the surgery and we we say, okay, showtime. And this is something that helps me a lot.
Yeah.
When I do that. And when I'm abroad doing live surgery, whenever possible, my dear wife is with me because she is my chief nurse, and usually when I'm in some conference in another country, she's with me, and so I'm lucky to have her to do instrumentation for me. So this works. But when I don't have someone from my team doing that, it's very difficult for me, not only because of that, because the yogi doesn't, and for this to work, you must have must have the other person in the same vibe so that we work perfect. Because the surgery, Milton has seen, it's let's say, it's not in a hurry, but it's quick. We don't have wasted time. That's the way to achieve efficiency. Yeah. So this is most important, that we are in the same, completely in sync for this to work. Yeah. So that's how I brought this. Yeah.
Yeah, interesting, because if we look at other areas of knowledge or practice, like, I mean, a tennis player, before he goes to serve, he usually has some I would say chicks, in terms of he scratches his head or something, but he primes in for that movement. Yeah. Or like a pioneer player or any other area, you may have some chicks or some triggers in order to prime for that moment.
Yeah, exactly. Yeah, tennis players usually pull the shirt. I'm a tennis player. Pull the shirt and adjust the shorts like that, and then serve.
Yeah.
You do that too. Exactly. I exactly like that for this reason, to bring attention and to trigger. There is some in hypnosis. There is something that it's called I know the name in Portuguese, signo sinal, that you, after some sessions, the therapist, let's say, I don't know how to say, imprints that in the patient, and he say, when I do like that, you do something, or you remember something. When you hear that, this is something like that. When you do that, it's like a signo sinal, let's say, something that immediately brings you in that state of mind and performs like that. That's something on this way.
Yeah, maybe Pavlov has.
Sure.
It's a conditional behavior that you can use during the surgery. So it's quite interesting. I'm going to try it.
Yeah, it helps a lot.
I know dog, but learning new tricks.
I think it's something that usually works. It comforts you, because you believe so much in that when you do like that, or I do like that, I'm let's say I'm comfortable that I'm going to the surgery in the state of mind. Let's say it implies that it's implicit that I'm. So this is something that maybe we're doing to indulge ourselves during the surgery and be more. But it works wonderfully.
And I think so many surgeons have their own.
Oh, sure. Probably some way of doing that. We like to do this kind of things.
Specific music at the first surgery, something like that.
Yeah.
Good.
Okay, be curious. Of course, you should be curious. Not only in, let's say, be curious to see if some techniques, something will work for you. Even if you say, I'm sure I'm not going to use this particular technique in every single surgery, but be curious to learn something new, because if you're not, you don't have this. Let's say you have this inertia to be, like, say, content with what we know, because we are performing, doing our practice well. We think that we don't need to learn new things, but we must be curious that. And it usually, let's say, surprises us, because sometimes you learn some new technique, you're not going to use it, but you learn things from this technique that you may use in your, let's say, other sets of skill. I don't know if I was completely clear, but you're not going, like, say, let's see, going to learn some pre-chopping technique with some specific kind of pre-chopper. Maybe you doing it with your current pre-chopper is better, but sometimes you experiment with some new instrument, and you learn a new way to use your other instruments that you wouldn't learn if you haven't tried this one. So I think this is an important character skill to have, to be curious.
What's the importance, in terms of curious, what's the importance of being playful? I always try to find the ludic or the playfulness of the journey. Is it something that you rely on when you're trying something new? Do you have this level of playfulness?
Oh yes, definitely, because I think what the biggest drive in me when I'm going to learn something, or when I'm curious to learn something, is this will be fun.
Wow.
This is most important, because if not, it's something like, oh, I want to learn or to test something different. It's, of course, it's difficult. You're in the, let's say, uncomfortable zone, and if you are not, if you do not appreciate this, that you're learning something, you're trying, and you say, no, I'll be able to learn that, it will be boring, and it will be, let's say, it will not be pleasurable. Even if you achieve that, as, oh, I learned that. But as we said, the journey is sometimes much more pleasurable than the result that you achieve.
Yeah.
You must learn to, must be, appreciate this, to that you're being able to learn, to practice something different, and you, so this is something that brings you some satisfaction. It's very satisfactory to see that you learned something new. More and more, we must be able to rely on our character skills, because technical skills get old very fast nowadays, because everything changed. So you must rely on technical skills. And I've seen, I don't remember where, but it was some book I read recently that said, with the advent of artificial intelligence, character skills are what will matter most for us humans, because many of the technical skills AI will take care of. So this is more and more important for us to have the, let's say, the not the correct set, but the important correct set of skills to be able to survive in this era, because everything changes so rapidly. And so we must be able, we must, yes, to feel comfortable being uncomfortable, because we are in a constant process of learning. We must be take pleasure to see that we are learning, to see that we are being able to learn and to achieving new skills or new knowledge. This is something very important, because if not, learning is very boring, gets very boring. So let's say, compare it to the school. In most, let's say, traditional educational processes, they are very boring. And so in this way, they are very counterproductive. So we must be take pleasure to take satisfaction when we are learning something. And this is most important when we are learning new things in surgery, because it's difficult. It will be a difficult process. If you're not, if you don't take pleasure in that, we will give up. I think we will give up, because we will have lots of failures. It's not a smooth process. So this is important for a surgeon to achieve.
Oh.
Yeah, be a Pollyanna. I don't know, maybe younger people don't know about this character, but what I mean is, be positive, think positive. When we have some, let's say, something that goes wrong, we must be able to see the positive side of bad things, of things that go wrong, because many times we only pay attention to the negative side, and just by doing that, we are not able to correct what's going wrong. Let's say we keep lamenting that something went wrong, and we weren't able to do something. And when we are, let's say, when you see the bright side, the positive side of bad things, when you're able to see that, you are able to improve these things and to learn with something bad that happened. So that's what I mean by being a Pollyanna. So when you have a surgical complication, see, wow, I learned from that. Because if you see only the bad side, which of course there is, you may lose the opportunity to learn with that. And we usually don't like to think too much when we do things wrongly. And you should, because that's the way you're able to improve that and maybe to correct and be able to be prepared not to repeat this error. So that's what I mean being a Pollyanna. Not in like some, let's say, how can I say, uh, some easy way with things. That's no, this is good because of that, and not to pay attention or to want to correct. That's not what I meant. But what I meant is being able to see the positive side of things is positive thinking is very powerful. So I think that's what I mean by being a Pollyanna.
Yeah.
Build an efficient team and learn to depend on it. This is when people ask me, well, say how I'm able to perform so many surgeries in a day with so much quality. This is the simple answer: because of my team. It's not possible for me to work like I work without the team, and they are responsible for many things, and they allow me to achieve, let's say, a much higher level of perfection and efficiency and effectiveness in my surgery. Because without them, I would have to be, let's say, taking care of so many things. And during my practice, I do not have to worry about anything else except the specific surgical step I'm performing. I know that everything else is taken care of. And to build an efficient team, it takes time, it takes so much effort, and you must have let's say, be able to find the people that are suitable for this work, because it's very hard work. We work long hours under, let's say, a lot of different pressures. We have time pressures, we have let's say, all the difficulties that arrive from dealing with people that are going to be operated on. So this is most important. So this is essential, not important only, essential for you to achieve let's say, a good practice, or to be able to perform surgery in another level of efficiency and perfection of your team. And I have the luck to have a wonderful team, and who manages my team is my wife Agda, and most of my assistants are with us for more than 12 years.
Wow.
It's a long time. So we are like not only like a family. When we're working, we know what the other one is thinking. So I'm able to, let's say, operate for 2 hours straight, without saying a single word if I need it, because everything goes smoothly. And most people that visit me are amazed at how much the whole team understand what's going on and assists me, and I don't have to ask anything, and I can operate. Nowadays I operate looking at the screen, because I use a heads-up system, 3D system, but even when I operated with the microscope, I would do the whole surgery without taking my eyes off the microscope. I knew that the instrument that will be put in my hand would be the one that I needed. And so I say to them, whatever you put in my hand, I'll use it. So be careful. And this is, of course, a most important part of my practice, my team. And we are like a family. They are so proud of the work they do. This is something that is very satisfying for me, and we work in a very light environment, and it's a happy environment. When we travel, it's like say a group of students doing some excursion and going to some. It's something that it's very pleasurable, and it takes a lot of the load of the work that being this camaraderie, yeah,
Yes.
I think, yeah. It's very nice. So we miss now that we are on vacation. Well, let's say 1 month at home. Of course, we enjoy, but we're looking forward to go back to work and see all of us. Yes.
You miss them.
Yes.
Yeah.
Yes. Well, enjoy and be proud of who you are and your work. Of course, this is most important. So, you must learn. You must appreciate what you're doing. né? I think Aristotle said, the one put pleasure in your work. Pleasure in the work puts perfection in your result. I don't know, I'm not quoting it right, but it's something along this line. You must be have pleasure in your work and in who you are. So in order to appreciate what you achieved and be able to achieve more. I think this is what I mean by that. So as you must see all your journey and say, wow, what I did was amazing, and be proud of it, so that you value that and aim to be better and better. That's what I mean about this. An anecdote of a moment of revelation. This was something that happened to me about 12 years ago. We were working in the state of Bahia in a little town of Santa Maria da Vitória, and we were a group of varying between 4 to 6 surgeons. And I usually, I was the most experienced surgeon, I would get the most difficult cases, the complicated cases or something like that. So they usually came from me to operate, and I can't recall what time of the day this happened, but it was like I was very tired. And then when the assistants are going to bring some patients, they usually tell a little before if they're going to bring some different cases. And so the assistant that positioned the patient said, "Doctor, there is a special patient. We use that to refer like if someone who was mentally impaired." And he said, there is a special patient to come with white cataracts bilateral. He's completely blind. And can I bring him in? So it's a 50-year-old patient. And then I immediately said, no, let's schedule him with sedation, because sometimes you don't have the cooperation, and it's it's common for us to do that, but it's very difficult in these settings that we work to have sedation, and it would probably take a long time before he could be operated. And so there came a nurse that was local, and he said, "Oh, please, doctor, you should operate him, because he is a very nice person. I think he'll cooperate, and he's in so great need." And then I said, okay, but I was like a little upset by that. And then they brought him, and he came in using a broomstick as a cane. And then he laid down, and I immediately saw that he would be able to cooperate. He was a very humble man, and very quiet, and it was, I don't know how to convey that, but he was aware of his disability,
Wow.
He was like what we would call in, let's say, in old times, a retarded person. And then when he laid down, I started when I started doing surgery in him, operating him. I started to he was moving a lot, so I started talking to him, so that he was not nervous, but he would pay attention on what I was saying and would be still. And so I was I asked him what happened, why he was blind, and then there is no way for me in English to talk like he was talking, because he had a very simple language. And he said, "Oh, Mr. Doctor, and there is some time that I am blind. I use it to work with my brother, my older brother, and we are gardeners. And I use it to help him because I have this problem." He knew he was
Wow.
like had a very mental issue. I used to help him clean the yard and something like that, but I could do some gardening a thing with him. But then I became blind, and my older brother that took care of me. And then he got this disease, the cancer, and he died. And I am alone. And there is a neighbor that brings me food, and it's a woman, and she takes my government pension because I am blind. She gets in the bank and cooks me food and brings me on the lunch and dinner, and do some cleaning in my house. I think she gets some of the money for her, but I don't mind. And but I am having a very difficult time now, because I, you know, it's difficult for me to tell that. I can only eat with my hand, because using a spoon I don't see where the food is. And I get very dirty. I get very dirty, and I know that I smell bad. So I am ashamed to go to the street, and so I stay mostly at home. And I am very happy that I now I'm going to be able to see. And he had complete confidence in the surgery that, let's say, we would cure him. And I can say that I had never felt so ashamed in my life for having thought that, oh no, let him have his surgery under sedation, and just because of a convenience for me. I was so ashamed by that. And I could see how brave, how courageous this little guy was, knowing that he was mentally impaired, he was completely blind, and even he was a happy person and trusted other people. Even the woman that skimmed some money from him for taking care of him. And I did the first eye, and then we operated both eyes at the time, and I operated the second eye. And when it finished, the patient, he sat on the table, and still like seeing fuzzy, and that immediate post-operative time, he looked at me and said, "Thank you, Mr. Doctor." And when the guy brought him the broomstick that he used it as a cane, I said, I don't need that anymore. And then he went, simply like that, as if this was, like, say, a simple thing. He trusted me completely. And, well, I must say that I had to stop the surgery many times because the oculars got completely, the microscope oculars got completely filled with my tears. And I extended the drape 2 times because I contaminated, because my tears, I operated in crying, hearing him telling this story. And when it all finished, I thought, I can be better than that. You know, he, let's say, when I thought about his condition and his will to survive, his perseverance, and his, his trust in other people, I thought, I can be better than what I do. I saw how important what I did was, and I wasn't valuing that. And I can say that there is hardly a day in my surgical life that I don't remember that. I don't remember him. And this commitment I made for being not only a better surgeon, but a better person. You can't imagine how much this changed me. The single event, when I'm going through, let's say, you said, I was waiting to answer that, what I would do in bad time. I remember him. I remember his resilience. And when I have a difficult surgery or difficult times, I remember, I know that I can be better. And so when I finish, I say, thank you, Gardner. He taught me so much. This humble person, this impaired person. And I think he could teach us so much because of the way he was. So I must honor him in every single surgery I do. And I think I'm really thankful for that to have happened to me, because this helped me, not help, but he's made me be what I am today in terms of being so persistent in achieving a better, let's say, surgery or something like that. I don't know if I'm able to convey that, because I felt so ashamed of myself when I remember what I initially thought, that just for my convenience I wouldn't operate him on that day. So I try to bring that every single day, and I remember him almost every single surgical day I have. Wow. When I have a difficult surgery, I think of him, because this was a so great driving force for me, and I really thank you, the little Gardner. Yeah. That's I don't know. That's what I brought, like a moment of revelation. I don't know if like that, but this brought the attention for me of how important what I do is for other people. After, let's say, some time, we forget that. We are insensitive sometimes of other people's needs and what we are able to bring them. And so this is something that helps me remember every day. Sorry about being so emotional, but...
Thank you for sharing this very personal and very emotional and important part of your life. I got emotional myself and all the colleagues here. This is the beauty of what we do. I think these stories are important for us as surgeons to transcend in terms of our work. We have the opportunity to find the meaning even of the life we are here on this earth. So thank you so much for sharing this story. Thank you so much. Let's go.
Yes, we're going through some quotes that express my beliefs. Sometimes we use quotes like, sometimes using a quote is cheating. Because you're saying something, you're repeating something, you're showing something that some, let's say, important or very intelligent, or let's say everyone sees by everyone as someone who was intelligent. So we are, let's say, we're cheating, bringing that. But these are some quotes that I think express some of my views as the other topics. Well, the first one is from Alfred Lord Tennyson, is to strive, to seek, to find, and not to yield. I think this resumes, the mindset of the surgeon has to have, to pursue what he believes, to be persistent, and not to give up.
Yeah.
Not to give up in difficult times. I think this is like
sometimes we are quite complacent with ourselves.
Yeah.
We are very judgmental from others, and we are complacent with ourselves.
So that was what I tried to
Yeah,
bring.
sure.
Yeah. Okay, this one is one of my favorites. And the reasonable man adapts himself to the world. The unreasonable one persists in trying to adapt the world to himself. All progress depends on the unreasonable man. This is very true, and this is one of my beliefs, and I really believe that I'm very unreasonable. And by unreasonable, I say I'm very optimistic. And I believe that we can achieve things that sometimes are seen as impossible. And that's what I mean by being unreasonable. If you're not unreasonable, you will not try to do difficult things that may bring you, let's say, hard times. And so that's why I really like this phrase. And usually great discoveries, great changes, great paradigm shifts in our history are made by very unreasonable men. So men and women. So I think this is why I brought this.
Yeah.
Yes, what I mean is you must be like thinking there must be a better way to do that.
Sure.
Yeah, that's like that. Being unreasonable to pursue that. So this one is a very, let's say, an old cliche. Genius is 1% inspiration, 99% of perspiration. This is from Thomas Edison. I don't like say, what I know about him, Thomas Edison as a person, but I really admire him as an achiever. And so this is what we were talking about genius. Sometimes what we see as geniality in someone is the result only of very hard work. Sure. This is like from the good side, because sometimes we don't see us as able to achieve something because, I'm not as intelligent, I'm not a genius like this guy, and that's not the point. Working hard, usually you get the...
and after all, it's good news. Because everyone is able to achieve a higher ground.
Yeah. Oh, this is something that I usually say to people. This is for the skeptical ones. nothing ever becomes real until we experience it. This is from John Keats. And uh, many times, this is something that I learned from, let's say, from for myself a long time ago. It was what I was saying about seeing something and not believing it. But let's say Milton comes to me and say, "No, Neto, I do this specific thing like that and it works." And then I said, "I think Milton is crazy because this can't possibly work." But some things you can only appreciate by doing them.
Yes.
And it's usually like a very surprising that you see someone doing something that you really look at and say, this is crazy, this is nonsense, but when you going to do it, you say, this is wonderful, and this works like a charm. So this is what I say to people when they doubt something that they say, or I show, or other shows. Sometimes when we are on a conference, we see one guy go up and talk about some technique or something that he or she does, and I see, let's say, without thinking too much, I think someone on the side say, "Oh, this is nonsense." I say, "How can he say that? Because this guy, he's a wise guy, and I don't think he would come up there and say something like." I don't know how to express, but in a very light way. He's been doing that for years. It must work. So we must give some trust, some confidence in people that sometimes show their experience, even if it looks too crazy.
Yeah.
Because sometimes when we go to do that, so we're not able to feel the real meaning of that unless doing that.
Yeah.
That's what this let's say only by experiencing something you see the reality of it. That's why I like this quote. Okay, a ship is safe in harbor, but that's not what ships are for.
Fantastic.
Yeah, of course. If you are too afraid of try different things because you think they are unsafe, you're not going to progress, because almost everything that you're learning and doing it for the first time are not as safe as in the hands of someone experienced. So you must go through this process. And sometimes this, let's say, "Oh, I don't think this is safe, I'm not going to do." He can do because he does it in a safe way. If someone does something let's say, is able to perform some technique, you probably able to. So I think this phrase, this quote is,
Yeah.
this is from Raul Seixas, and it's something that I think resumes our what we should be, as not conform to be someone with aesthetic knowledge. So being this walking metamorphosis instead of having that old opinion about everything. And this, let's say, that old opinion about everything is something that pervades medicine, prevents medicine from evolving. It's amazing how many dogmas we have in medicine that go on from years until someone has the guts to take it apart and show that this is not. So I think this resumes that. We are usually comfortable in having, let's say, embracing old opinions about something, but most things can and should be improved. I like this music because of that. I think it's
for those who don't know Raul Seixas,
Yeah.
who's a singer from Brazil, he was the sole partner of Paulo Coelho. Paulo Coelho is he composed some musics with Raul Seixas, and Paulo Coelho is mostly famous worldwide by some books. I think The Alchemist,
Yeah.
and other books. So Raul Seixas was an anarchist at that time. Well, his legacy endures for the eternity.
Oh yes, this is a good coda for this meeting. Yeah. From Yoda. Do or do not. There is no try.
Yeah.
Believe in yourself. Go and do it. That's the way you should face things. Do not waver or doubt yourself. If you do it, you are not being able to achieve what you want. And I think this is a very short quote, and something that we could, let's say, use as a to, let's say, do it. Believe you can do it.
Yeah. Do you recall this quote when you're trying something new, or you're trying something that is very uncomfortable to you, but you know that you must move forward, and you know, when your doubts and your insecure part comes in?
Yes, not exactly like that, of course, but like I must do it.
Okay.
I must.
Just do it.
Yes. Yeah, I don't like Nike. Okay.
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 No problem.
But yeah, but I must do it. I must. Let's
forward.
say yes. There's
Yeah.
no other option.
Yeah.
And when we think like that, we do it because we get the strength. We get the will to achieve that. So yes, I think this is. Let's say I think Yoda is the biggest badass in universe.
You're right.
Yeah.
Yeah, absolutely. I'm a Star Wars fan, so I have to agree.
Yeah.
Good. Okay, Neto, thank you so much for your time. The invitation I made was exactly for this, because I'm a huge admirer of you, of your surgeries, but also, I'm admired by knowing you for so long now. I wanted to share part of your mindset and your philosophies with a larger audience, because so many of them just see you by your videos in your YouTube channel, and to achieve such a high performance and such a high proficiency, it's very important for us, for myself, to understand the mindset and the way you face your work, your ethics, your way of learning. And I learned so much from you again, and I have also colleagues and fellows that went to watch your surgeries in your daily practice, and they also come amazed by what they see. I wonder if colleagues from abroad can come in and also watch your surgeries as well.
Yeah, sure. We love receiving colleagues and sharing experience. So everyone is invited. It's a pleasure.
Good.
Yeah.
How can they
I think in my channel there is my. I think the best way would be by email. In my channel, my YouTube channel, there is the about tab. It has my email, Rosatelli at mac.com. It's an easy one. It's from
Okay.
my Apple, yeah. So, and everyone is welcome. Yeah.
Good.
And thank you for the kind words, my
Yeah.
dear. It was a wonderful evening here, sharing experience and some points of view. And I hope it's been good for everyone. And it was wonderful. So thank you for the opportunity to be here.
Thank you so much. Thank you, and I hope you enjoyed, and bye-bye. Muito bem. Muito bom.
Obrigado, Milton.
Muito obrigado.
Foi muito bom.